Good morning. I'll be giving medications to patient Shelly Anderson in room 12-1. 112-1. All right, and we're checking for her aspirin. Aspirin here in the MAR, checking in the MAR. 81 milligrams daily, and that's given at 9, so that's scheduled. And that's a tablet, all right. Diltiazem hydrochloride, that's also scheduled at 9, and that's a pill tablet, 60 milligrams given daily. Oh, and I see there's a note here from the doctor to hold if systolic blood pressure is lower than 90, or diastolic blood pressure is lower than 60, or heart rate is lower than 60. So we'll check that before we administer. We have Docusate, which is 100 milligrams daily. That's also a capsule, and that's once given at 9. It's a scheduled. Furosemide is going to be given a little bit later at 11, and we're going to have to check her blood pressure before we give that. And levofloxacin is given at 9, and that's 500 total, twice a day, every 12 hours. And it comes in tablets of 250, so, and those are oral tablets. And we're gonna go get those medications, and we're gonna double check them again, cross-reference them, okay? All right, here we have the medications that we have for Shelly Anderson. Making sure that we check everything. Aspirin, 81 milligrams. And we have on the MAR that it's 81 milligrams. And the expiration date is 12/30. Okay, so we got that. Diltiazem, 60 milligrams, and diltiazem 60 milligrams, and we're going to check her blood pressure and her heart rate for that before we give that, just to make sure that we keep our patients safe. Docusate sodium, that's a stool softener. We'll be giving that. That's 100 milligrams, and we're going to ask her if she has any loose stools before we administer that, and that's expiration date 12/30, and that's 100. Everything matches. And then our next is levofloxacin, and those are 500, so 200 and 200. Expiration date 12/30, 12/30. Okay, so we have that. So before we go into the patient's room, I'm going to check the patient's labs, because aspirin, it's a blood thinner, and we want to make sure that her platelets are normal. And we're going to check for levofloxacin. We're going to check her white blood count, which were drawn earlier today. So we have here the white blood count is 12.3, which is a little elevated. So we are going to continue giving her the levofloxacin, the antibiotic. And the platelet count is 300, which is in the normal range. So before we give her the aspirin, we'll definitely ask her if she has any bleeding or any signs of bleeding. All right, so we're gonna put these in the medicine cup, and we're gonna check them again in front of the patient, and hopefully we'll be giving them to the patient. I'm gonna bring my scanner with us and my computer so we can check the MAR at the bedside. Okay, and I'm gonna bring you guys along with me so you guys can see how I'm gonna be giving the medications to Miss Anderson. All right, making sure that everything's visible. I'm gonna bring you my WOW here. I'm gonna knock on the patient's door. Knock, knock. Good morning, Miss Anderson. My name is Sam. I'm going to be your nurse today. I'm going to wash my hands. I'm going to close the curtain, give you some privacy. Okay. And the doctor has ordered some medications for us to give to you today. Is that okay? Did you have breakfast this morning? You did? Perfect. You ate a good amount of food. Everything was good? All right. Is it okay if I check your armband? Just to double check your name and your date of birth? Okay. And what is your name? Shelly Anderson, and your date of birth? 12/34. Okay, perfect. Everything matches. Let me double check and make sure that everything matches, okay? And you said your name was Shelly Anderson. Okay, and your date of birth again, please. Perfect. Everything matches. Okay. And do you have any allergies? Let me check your band to make sure you don't have any allergies. Okay. Do you remember if you have any allergies? You do, right? Penicillin, right? Yes. All right. So we'll be making sure we don't give you penicillin. Okay. I have a couple medications that I have here for you: aspirin, diltiazem, Docusate, and levofloxacin. Okay. I'm gonna start with diltiazem because I need to check your blood pressure before I give you this medication. Okay. So this will establish a baseline. To make sure that it's safe for you to get this medication. Okay. I'm gonna put some gloves on and put some gloves on here. Okay. All right, and I'm gonna check your blood pressure and your apical pulse. Okay. Is that okay with you? All right. So which arm can I borrow? The right arm? Okay. I'll take the right arm to check your blood pressure. Okay, good. Blood pressure is 130. Blood pressure is 130 over 88. All right, I'm gonna check your apical pulse, okay? All right, it's a little low. It's 50. So that means I can't give you the levo. I mean the diltiazem right now. And I'm gonna chart that in the patient's chart here. I'm gonna scan the patient's wrist. Beep. I'm gonna scan the medication. Beep. And I'm gonna update here that the blood pressure was taken and that it was low heart rate. So we'll try again in an hour. Okay, we'll try again in an hour. Okay. So we'll be putting this on the side here because we're not going to be giving that right now. And then the next one I'm going to be giving is aspirin. All right, aspirin. Miss Anderson, have you had any bloody stool, any bloody urine, or any signs of bleeding in any part of your body? No? Okay. All right, we'll be giving that to you. I'm going to put that in the medicine cup because that is confirmed to give. The next medication, and I'm going to just scan that. Beep. And I'm going to chart that the patient's platelet levels was in normal range. It was 300, so I'm going to chart that. And I'm going to put that in the medicine cup. The next medication I'm going to scan is Docusate, but do you have any do you have any loose stools? Have you had a, yeah? You don't have a loose stools? No? So this medication is to prevent you from straining or becoming constipated, which we don't want that. So we'll be giving to you that Docusate. Is that okay if I give that to you? Okay, so that's confirmed. We're going to give that, and then we're going to put that in the medicine cup. And the last two medications that I have to give you are levofloxacin. I'm going to just scan the Docusate deep and say no loose stools reported by the patient. All right, we're going to put that again in there, double check everything, right? And then the levofloxacin. The levofloxacin is an antibiotic because you're here for pneumonia. This will help you fight off those the bacteria in your lungs so you can get better soon, okay? Is that okay if we give that to you? All right, so I'm gonna scan these two, beep, beep, and I'm gonna chart here that the patient's white blood count was checked and that it was 13.2, was it 13.2? Yes. No, it was 12.3. So still elevated. Double checking everything, making sure that the levofloxacin meets the criteria. So we're gonna giving them here. Okay. Miss Anderson, would you like to get your medications with water or with pudding? Water is perfect. Okay, so I'll be giving them with water. Would you be giving them, would you like to get all the medications at once or individually? You prefer all at once? Okay. So I'm going to sit you up a little bit. Is that okay? Sit you up. Okay. All right. And I'm going to be giving you the medication. Water, you said, right? Perfect. Water. Here's your medication. Okay. I'm going to be putting that here. And some sips of water. Okay. Everything okay? Okay. So we're done with that. Okay. Everything okay? Would you like to sit up a little longer? Yeah? Okay. So I'll leave you sitting up. Okay. So we are done. I'm gonna chart that medication was given. Okay, patient is okay. And for the diltiazem, I'll come back in an hour to check everything, to check your vital signs again to make sure that you are okay with your vital signs, and if you're okay to take those medications later. Okay. All right. Anything else I can help you with, Miss Anderson, while I'm here? No? Okay. So, Miss Anderson, I'm just going to take my gloves off. Actually, before I do that, I'm going to lower the bed all the way down. Make sure that your bed is all the way lowered. Side rolls are up. And I give you the call light. Here's your call light, okay? Call if you need anything, okay? Everything looks good, okay? Call if you need anything. So what I would do is I take my gloves off. Take my gloves off, put them in the trash. Wash my hands, open the curtain, and take my stuff and leave the patient's room. And I will document I'll document everything I did for the patient. And we'll come back for the diltiazem later, just to make sure that she is eligible for that medication. All right. Thank you very much, and I hope that Miss Shelley Anderson gets better. Thank you.